Hello students, this is Faizan Mirza. We are discussing the topic of tuberculosis in infectious disease. So tuberculosis is an infectious disease, and in this diagram, figure 10.12, you can see the chest x-ray of a person who's suffering from TB in the lungs. Now, this diagram shows to you some white patches which you can see here. These white dots, these are the regions where the TB pathogen, which is the bacteria, it has formed some colonies here. So it is colonizing these parts of the lungs. So the tuberculosis pathogen is there in this tissue, in this organ right now. If you see and compare it with the with this other lung, the left lung, you can see that they're not such colonies here. But yeah, here this area is highly affected. So what is tuberculosis? Tuberculosis primarily occur in the lungs, but it can be occurring, it can affect other body systems and body organs as well. But we'll be restricting our discussion to the tuberculosis of lungs. So generally, one third of world's population is infected with the pathogen. The name of the pathogen is M. tuberculosis. Only 5 to 10% they become sick or they start to show symptoms in the lifetime. Nobody knows that how many people are there of tuberculosis pathogen carrier, and they do not show any sign and symptoms. The bacteria remains dormant in their lungs. It means that it just lives in their body. It will never just come out and cause the disease. But such people can cause the pathogen to be transferred to other people. So these are the carriers of tuberculosis, and they are the biggest challenge. So there are people who are carrier of tuberculosis, and they die without even knowing that they had tuberculosis ever, because the disease never began. But the pathogen was very much there. It was in the dormant phase, but if it went in another organism or another individual, it can cause the disease, or it can stay dormant. It completely, the pathogen chooses this by itself, whether it wants to stay dormant in an individual or whether it wants to become active. So if the person is malnourished, is suffering from inferior health, that means a weakened immune system. So in that case, a chronic infection may develop, and this develop mostly within the lungs. The bacteria starts to destroy the lung tissues, and blood vessels are broken down, and the fluid then starts to accumulate within the lungs, which you can just see here. I have underlined these keywords here, which shows up on the x-rays as well. Now furthermore, TB can, as I just mentioned, it can occur in any part of the body. It's not only occurring in lungs. The patient normally suffers from loss of appetite, extensive loss in weight, and excessive sweating, and there's a decline in the physical activity as well. So these are the features that you can normally see in people suffering from tuberculosis of lungs. Then discussing the pathogen here. So the pathogen here is the bacteria, which is rod-shaped bacteria. It is Mycobacterium tuberculosis, and the other bacteria is Mycobacterium bovis. So there are two bacteria, both of them can cause tuberculosis. Mycobacterium tuberculosis causes it to be in human host, whereas bovis causes it in the cattle. And the thing is that you can see that it has been seen that people who are having Mycobacterium tuberculosis, this pathogen of humans can transfer that pathogen to cattle, and cattle can transfer it to other cattle. So cattle is also seen to be suffering from Mycobacterium tuberculosis TB. And cattle host normally is infected with their own pathogen. This is Mycobacterium bovis. They cause TB in cattle, but this cattle can infect human, and then the human can become infected with Mycobacterium bovis, the other organism which normally is occurring in cattle, but it can get TB in humans as well. So once the human become infected with this, they can transfer it among themselves. So primarily, Mycobacterium tuberculosis is the pathogen of humans. Mycobacterium bovis is primarily of cattle, but then this crossing can occur, and the transfer can be seen. Transmission is normally by droplet transmission from the lungs of infected person or from the dust of their homes. A prolonged contact is required for the bacteria to go in the body. and normally this bacteria is not very infectious, so that's why it takes years for the TB to settle and become active. Milk, if you are using unpasteurized milk from an infected cow, or undercooked meat is being used, then it can go, if it's there, the mycobacterium bovis is there in the meat or the milk of the cow. So if you are using unpasteurized milk, unboiled milk, boiling, not boiled in the proper way, or not pasteurized, and the meat is undercooked, so the person can get TB of this cattle from them as well. So the disease parameters: the primary infection is in lungs, but it spreads to lymph as well, and when it's going to the lymph, it go to the reproductive system as well. If it goes to reproductive system, it goes to digestive system as well. So these are the other systems that can get affected. Sign and symptoms include persistent cough. We call this as racking cough. So racking cough can be seen, and racking cough is a major, you can say, a cause of spread of this disease from one individual to another, because because of them, the phlegm is there, the sputum is there, and when they spit it out, or when the droplets are released from their coughing, a person in their vicinity can inhale those, and this can cause the bacteria to get transferred there. Fatigue is there, loss of appetite, as I've just mentioned, fever and stuff. So the confirmation can be done by a skin test, or in a chest X-ray, or the bacterial, you can say, a test in which screens the bacteria in this sputum, and the culture test, which you call it. How's the treatment? The treatment is a long-term treatment. The treatment includes antibiotic course, primarily isoniazid and rifampicin, and they are given for at least 6 to 9 months. That's a very long time, and the antibiotics have to be taken continuously. For prevention, BCG vaccination is used, and prognosis improvement occurs within 2 to 3 weeks of early diagnosis and starting of the treatment, but the full recovery takes about 6 to 12 months. If in patients who are suffering from HIV/AIDS, then they are seen to get opportunistic infection from TB. So people of HIV/AIDS, they end up getting tuberculosis because their immune system is quite a bit weakened. TB which did not get diagnosed, and which was occurring which was affecting a person, if it was not treated properly, it would spread to other organs and it would be fatal. So distribution, it occurs worldwide, and it's a global phenomena. So you can see these are the various shades all across the globe, which actually represent the occurrence of this disease in the globe overall. So you can see Pakistan. This is Pakistan. This shade cases per 100,000 per year. So you can just look. This is Pakistan, and this is actually the same case, not in Pakistan, in India and China, and all these regions, and in the USSR, this is Russia. So, and this Nepal and stuff. So this is the condition which is in Pakistan. So why don't you just for your own understanding, make a list of reasons why do you think TB is endemic in Pakistan? So TB is actually endemic in Pakistan. Endemic means that the disease is always there in the population. According to epidemiology of Pakistan, the estimated incidence of TB is about 250,000 per year in Pakistan, and existing patient load is about 1.8 million. That's pretty big. So TB kills about 64,000 people in Pakistan each year, and 26% of the nation's avoidable deaths. So these deaths could have been avoided, or could still be avoided, if TB is eradicated, or it's the occurrence or the incidence of the TB is lowered somehow. Most of the patients are in the age of 15 to 45, and you can see that this is the actual age where the person is most active. So if people, they are suffering from this disease, they suffer from lethargy and weakness, and they don't have enough strength. So you are actually going down with people who don't really have enough energy in this age group. More males, 52% males, and as compared to females, according to the figures which are given by the government. At that time where this was tabulated, it was back in 2001 when the national emergency was imposed in Pakistan, and TB was declared as a national emergency. At that time, Pakistan ranked 6th among 22 high burden countries of TB, because we have a lot of carriers of TB, and TB is actually quite prevalent in our country. How do you go for treatment of TB? As I told you, there is a course of antibiotics, and there are a lot of challenges in there as well. So the most common antibiotics that are used are isoniazid and rifampicin, which are used for 6 to 9 months for proper treatment. And when you are doing these kind of treatment, there are things that need to be kept in mind. The biggest challenge is drug-resistant TB. Drug-resistant TB is there are cases in which this pathogen, if the pathogen keeps on, it is mutated, and the mutants are resistant to the antibiotics that we are using. So if the person, and normally this develops because the person stopped taking the medications and the bacteria, before the bacteria was completely eliminated, and the bacteria starts to spread throughout the body, and there's an increased likelihood that mutations will arise, and these mutations all occur by chance. So stopping treatment early, because it's a long time treatment, it takes 6 to 9 months for it to be treated. So people are, when they start to feel better, at times they stop taking the medications. So that's the biggest problem that actually came across, that health agencies came across, and this is the cause of drug resistant TB strains forming. So people in whom tuberculosis develop resistant to all the drugs which is used, this is because people do not complete the course of the treatment, and such people are likely to infect others with drug resistant forms of TB. And if this is occurring, then there will be more cases of people suffering from drug resistant TB in which isoniazid and rifampicin cannot be used. Overcrowded conditions are the biggest cause of why controlling TB outbreak is not very easy, because people living in overcrowded conditions, or traveling in overcrowded buses or overcrowded mass transport, so there's a lot of inhaling of droplets or touching of objects which have been touched by people who suffer from this disease or are the carriers. So WHO, it uses a scheme of DOTS. DOTS is direct observation treatment short course. It involves the health workers or the responsible family members making sure that the patients take the medications regularly for 6 to 8 months and they do not drop it. So that's the basic aim of DOTS, which was initiated by WHO. Over the years it has been seen, and actually with DOTS it's been seen that yes, with drug therapy, with family assistance and a good follow-up, 95% of cases they get cured. This is twice as more effective as any other strategy that was imposed before that. The drug-resistant form of TB, these include MDR-TB, multiple drug-resistant TB forms. This MDR-TB is resistant to at least two main drugs, isoniazid and rifampicin, and if they are not used, they cannot be used, then obviously you have to go for some other medications from them. And then there is XDR-TB as well. This has emerged, and this is something very serious threat to the health, because this individual XDR-TB strain, it is resistant to the first line of drugs and to the drugs that are used to treat MDR-TB as well. So you can see that the bacteria over the years, it is becoming more and more resistant. So first of all, you were able to cure with isoniazid rifampicin, then became resistant and became MDR-TB, and now you have XDR-TB, which is very difficult to treat. It just will not, these medications won't work, and even the medications that you were using to treat MDR-TB, they don't work with XDR-TB. So people on XDR-TB, if they are diagnosed, you have to give them other medications, and then with DOTS they are trying to ensure that people who are suffering from TB strains of XDR, they are treated in isolation, and the family is taken in loop that okay, this patient is now suffering from a very strong kind of bacteria of tuberculosis. This is not just random TB, and it will be treated with antibiotics which are way more expensive. And if the practice of this practice, if stopping taking the medications, if this continues, then soon XDR-TB will mutate, and we will have another form of this pathogen, which will be difficult to cure with even medications which are currently treating XDR-TB. This graph here, it shows to you the period of span from 1990 to 2000, and you can see that deaths, they are actually reporting deaths from TB in England and Wales in 1900. From 2000, they show a huge decline. So there was a decline here. Why? Because there were improvements in the housing provision and the diet of the poorest people in the society. So they became their immunity got improved, and they were able to ward off the pathogen. And then at this point, somewhere in 1940, first anti-TB drug treatment discovered at this point in 1940s. And then this is the point in time where BCG immunization was started in Wales and England, and some countries outside England, they started opting for this particular vaccine as well. So you can see that the load of the annual deaths in thousands have dropped down immensely from this value of about 65,000 to literally very low. So this actually shows to you that how much improvement they have come across this England and Wales just by working on these conditions. So it means that overcoming TB is not an issue, and it can be done. The vaccination policy, UK and USA, UK were the first ones where they were babies are normally given BCG vaccination. BCG is a vaccine, Bacillus calmette-guerin. This is the common most used vaccine. The UK uses it, and the USA have not used it. India and Pakistan were the first countries outside Europe to do so back in 1948, and this still goes on. Brazil introduced it in 1967. Malaysia, they give it once at time of birth from 2001. The same goes for Singapore as well. In Taiwan, they give one dose at birth and repeat it at the age of 12, because we all have different genotypes. So the vaccine, the dose that works in one nation may not work in the other nation, or in the other nation at the same dose. So in South Korea, it was given, but recently they have discontinued for reasons best known to them. In USSR, which include Russia, so this is given throughout life. So that's pretty much it about tuberculosis from my side. Thank you so much.